Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024, which explored the use of wireless pH monitoring to evaluate acidic gastroesophageal reflux in French Bulldogs suffering from sliding hiatal herniation. Sliding hiatal herniation, also known as type 1 hiatal herniation, along with the subsequent development of gastroesophageal reflux disease, are common health issues in brachycephalic dog breeds. Brachycephalic breeds are those with shortened muzzles and flattened faces, and their popularity has been on the rise, especially the French Bulldog, which is currently the most popular breed in the United States. This increased prevalence underscores the need for better methods to diagnose and treat both sliding hiatal herniation and gastroesophageal reflux disease in these beloved companions. Sliding hiatal herniation can be diagnosed non-invasively using a procedure called swallowing fluoroscopy. This technique allows veterinarians to see the intermittent displacement of the junction between the esophagus and the stomach through the opening in the diaphragm where the esophagus passes. However, this method can sometimes produce false negative results, and it doesn't provide information about the nature or how often gastroesophageal reflux disease occurs. Management of these conditions often involves medications that suppress acid production and drugs that help with the movement of food through the digestive system. In some cases, surgical correction of the brachycephalic obstructive airway syndrome, a condition common in these breeds that affects their breathing, or surgery to address the laxity of the hiatus, the opening in the diaphragm, may be considered. Unfortunately, the response to medical therapy or surgery can vary considerably, and it can be difficult to objectively assess how well a treatment is working when relying solely on the clinical signs observed by pet owners. The clinical signs of sliding hiatal herniation and gastroesophageal reflux disease in dogs can range from subtle indicators like lip smacking or frequent swallowing to more noticeable signs such as obvious regurgitation, difficulty swallowing, or repeated episodes of coughing that can occur if food or water is inhaled into the lungs. Sometimes, pet owners may misinterpret these signs, perhaps thinking they are normal for the breed or confusing regurgitation with vomiting. To overcome this subjectivity, an objective diagnostic tool like pH monitoring could be very useful. This technology can help assess gastroesophageal reflux disease in brachycephalic dogs with sliding hiatal herniation, link reflux events to the clinical signs reported by owners, and evaluate the effectiveness of different treatments. While catheter-based pH monitoring has been used in the past to measure reflux in brachycephalic dogs, a definitive diagnosis of sliding hiatal herniation was not always performed in those studies. Furthermore, there are some limitations to catheter-based pH monitoring that can affect the assessment of gastroesophageal reflux disease. For instance, dogs typically need to be hospitalized for the duration of the data collection, which is usually limited to 1 or 2 days and can be stressful for the animal in a hospital environment. The catheter, which is inserted through the nose, can also block narrowed nostrils, further increasing discomfort and potentially worsening the breathing difficulties associated with brachycephalic obstructive airway syndrome. A catheter-free, wireless pH monitoring system, which utilizes a small capsule called the Bravo pH capsule, is often preferred for evaluating gastroesophageal reflux disease in human patients. This system can continuously monitor acidic reflux for up to 96 hours after the capsule is placed. The primary goals of the study were to use this wireless Bravo pH monitoring system to evaluate acidic reflux and its connection to owner-reported clinical signs of regurgitation in a group of French Bulldogs that had been diagnosed with sliding hiatal herniation. A secondary goal was to evaluate acidic reflux in a subset of these dogs after they underwent surgery to correct their brachycephalic obstructive airway syndrome. The researchers hypothesized that the amount of acidic reflux would be considered abnormal based on human definitions of gastroesophageal reflux disease, and that reflux events would have a varying correlation with the regurgitation observed by pet owners. They also anticipated seeing an improvement in acidic reflux after the corrective brachycephalic obstructive airway syndrome surgery. Now, let's move on to the findings of this important study. 11 French Bulldogs were enrolled in the study. The median age of these dogs was 21 months, with most being between 17 and 35.5 months old. Their median weight was 10 kilograms, ranging from 8.9 to 11.5 kilograms. The severity of their brachycephalic obstructive airway syndrome was categorized as mild in 3 dogs, moderate in 4, and severe in 4 dogs. All 11 dogs presented with clinical signs of regurgitation. Other reported signs included hacking or gagging while eating in 6 dogs, hacking or coughing unrelated to eating or drinking in 3 dogs, and a history of hard swallowing or repeated attempts to swallow in 4 dogs. To diagnose sliding hiatal hernia, thoracic radiographs were performed, which identified the condition in 3 of the 11 dogs. All 11 dogs showed evidence of brachycephalic obstructive airway syndrome on lateral cervical radiographs. Swallowing fluoroscopy confirmed a hiatal hernia in 10 of the 11 dogs, and all 11 dogs exhibited gastroesophageal reflux during the procedure. The one dog not diagnosed with a hiatal hernia on swallowing fluoroscopy was diagnosed based on thoracic radiographs and abdominal ultrasound. Abdominal ultrasound also visualized a hiatal hernia in 4 out of 10 dogs where the procedure was performed. Endoscopic examination of the esophagus, using a procedure called esophagoscopy, identified a hiatal hernia on forward viewing in 2 of the 11 dogs and a widened opening of the esophageal hiatus in 7 of the 11 dogs. Notably, all 11 dogs showed evidence of esophagitis, inflammation of the esophagus, based on the presence of redness or a granular appearance of the esophageal lining. Only one of the 4 dogs that underwent brachycephalic obstructive airway syndrome surgery showed a resolution of these signs of esophagitis after the surgery. No esophageal erosions or ulcerations were observed in any of the dogs. All 4 dogs that had brachycephalic obstructive airway syndrome surgery had a wide esophageal hiatus identified during endoscopy, both before and after the surgery. The Bravo pH capsule placement was successful in 14 out of 16 attempts across all procedures, including initial placements and follow-up procedures. The capsule was typically placed about 26 centimeters from the incisor teeth. The median duration of the capsule placement procedure, which included a thorough examination of the esophagus and hiatus, was 31.5 minutes. The detachment of the capsule from the esophagus and its passage in the stool was confirmed in all cases. At the beginning of the study, before any surgical interventions, the median time the pH was below 4, known as the acid exposure time, was 3.3%. The median number of reflux events detected was 70. According to human definitions, an acid exposure time greater than 6% and a D-Meester score, a composite measure of acid exposure, greater than 14.7 are indicative of elevated acid exposure. Based on these human criteria, 4 out of 11 dogs had elevated acid exposure time and 5 out of 11 dogs had elevated D-Meester scores. However, only 3 of the 11 dogs met the more stringent human criteria for a definitive diagnosis of gastroesophageal reflux disease, which requires an acid exposure time greater than 6% for at least 2 days. Interestingly, the study found that older dogs tended to have lower acid exposure times. However, factors like sex, body condition score, scores on a questionnaire assessing swallowing function called the Dog Swallowing Assessment Tool, the severity of brachycephalic obstructive airway syndrome, and the endoscopic visualization of a hiatal hernia or a wide hiatus were not associated with the acid exposure time. The study also looked at whether excluding the immediate post-anesthetic recovery period from the pH data analysis would change the results, but no significant differences were found. When comparing daytime and nighttime periods, the total time available for analysis was significantly longer during the day. Moreover, the acid exposure time and the rate of reflux events per hour were both significantly higher during the day compared to the night. However, the percentage of acid exposure time did not significantly differ between the first, second, and third days of data collection. 4 of the 11 dogs underwent surgery to correct their brachycephalic obstructive airway syndrome. This surgery involved procedures like staphylectomy, palatoplasty, allarplasty, and sometimes tonsillectomy and laryngeal sacculectomy. All 4 dogs showed a numerical improvement in their acid exposure time after the brachycephalic obstructive airway syndrome surgery. Additionally, a subset of these dogs showed improvements in their dog swallowing assessment tool scores and brachycephalic obstructive airway syndrome grades. One dog, however, showed improved acid exposure time but no improvement in the other 2 measures after staphylectomy and allarplasty. This dog later had surgery specifically to address the hiatal hernia, which improved the dog swallowing assessment tool score but resulted in only a minimal change in acid exposure time. Finally, let's discuss the implications of these findings. This study successfully demonstrated that wireless pH monitoring using the Bravo capsule system is an effective method for documenting episodes of acidic reflux in French bulldogs with sliding hiatal herniation. The capsule placement was performed without significant complications and allowed for data collection over a median of 3 days, which is longer than what is typically possible with catheter-based pH studies. Although the capsule placement required general anesthesia, the pH data remained consistent across the 3 days of monitoring. The finding that acid exposure time was higher in younger dogs and during the day compared to the night is interesting and warrants further investigation. Despite all dogs having sliding hiatal herniation and clinical signs suggestive of gastroesophageal reflux disease, only a small proportion met human criteria for the condition. This highlights the possibility that the normal ranges for acid exposure time in healthy dogs may be different from those in humans. Compared to studies using catheter-based pH monitoring in brachycephalic dogs, this study focused specifically on French bulldogs diagnosed with sliding hiatal herniation. The fact that acid exposure time was higher during the day in this study contrasts with findings in non-brachycephalic dogs with clinical signs of gastroesophageal reflux. A possible explanation for this difference could be that brachycephalic dogs are more susceptible to increased reflux during periods of activity, higher temperatures, and frequent eating and drinking throughout the day, which can worsen their breathing difficulties, increase abdominal pressure, and predispose them to hiatal herniation and reflux events. The study did not find a strong link between acid exposure time and clinical scores from the dog swallowing assessment tool, the severity of brachycephalic obstructive airway syndrome, or endoscopic findings suggestive of sliding hiatal herniation. The numerical improvement in acid exposure time seen in all 4 dogs after brachycephalic obstructive airway syndrome surgery suggests a potential benefit of this surgery in managing reflux in dogs with sliding hiatal herniation, although the small number of dogs in this subgroup prevents definitive conclusions. Surgical correction of brachycephalic obstructive airway syndrome may help by reducing negative pressure in the chest that can contribute to hiatal herniation and reflux. The one dog that did not show clinical improvement after brachycephalic obstructive airway syndrome surgery but did improve after hiatal hernia surgery, despite minimal change in acid exposure time, indicates that some dogs may require both types of surgical interventions. The variable correlation between owner-observed regurgitation and capsule-detected reflux events underscores the inherent subjectivity of relying solely on owner observations. The Bravo pH capsule technology can capture reflux events that might be clinically silent or subtle and provide a more objective assessment of gastroesophageal reflux disease. For instance, this technology could be valuable in identifying silent reflux in dogs with recurrent aspiration pneumonia, even though none of the dogs in this study had clear radiographic evidence of this condition. The study acknowledges several limitations. The Bravo pH capsule can only detect acidic reflux, not weakly acidic or alkaline reflux, which would require different technology. The need for anesthesia for capsule placement could have temporarily increased reflux and introduced variability due to the anesthetic protocols not being standardized. While endoscopy was performed, gastrointestinal biopsies were not routinely taken to rule out other underlying gastrointestinal diseases, although dogs with significant gastrointestinal signs were excluded. The lack of standardization in diet, activity, and the surgical approach for brachycephalic obstructive airway syndrome correction across the 4 dogs that underwent surgery could also have influenced the results. Furthermore, feeding a liquefied diet during the monitoring period to prevent capsule detachment might have affected the frequency of observed clinical signs and detected reflux events. Finally, the selection of owners willing to participate in a study involving anesthesia and intensive monitoring may have introduced a bias towards more motivated owners and dogs with potentially milder conditions. In conclusion, this study demonstrates that Bravo pH capsule technology is a valuable tool for documenting and quantifying acidic reflux in French Bulldogs with sliding hiatal herniation. The finding of higher esophageal acid exposure in younger dogs and during the day is noteworthy. The study also provides preliminary evidence suggesting that surgical correction of brachycephalic obstructive airway syndrome can improve acidic reflux in some affected dogs, although further research with larger sample sizes is needed. Despite its costs and the specialized expertise required, Bravo pH capsule technology offers a more objective approach to assessing and managing gastroesophageal reflux disease in brachycephalic dogs with sliding hiatal herniation, similar to its use in human medicine. Thank you for listening to the Veterinary Research Channel. A link for the reference paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.